Hi, welcome to the Fit and Healthy Today show. And today our topic matter is impotence, or also known as erectile dysfunction. Now, we've touched briefly previously on this subject, but I wanted to expand a little bit upon it and give a little bit more information about the numerous causes of it, and to make notation that it's not necessarily something that somebody suffers from later on in life. As a matter of fact, when it involves impotence, age has nothing to do with it. All the studies, everything that came out on this particular topic matter says it isn't age. So whether you're 20 or you're 80, and if you have these issues, you'll have problems. If you don't, you won't. When we look at the definition of it, there's two different kinds. There's a primary, which generally occurs at birth or when there's extreme trauma in the early childhood years, such as sexual abuse or physical abuse. And then we have the secondary, which tends to occur later on in life due to some of these other causes. If the primary is there in existence, it would be difficult for a man to get an erection or all the time from the time he's a boy on upward. And generally that's a very difficult issue to resolve short of psychological counseling if it's psychologically induced, but more often than not it's due to physical problems in childbirth or because of a birth defect. When we talk about the cause of secondary impotence, number one on the list is going to be nutritional deficiencies. And with the standard French fry and hamburger diet that we have out there, we're seeing a lot of these. I mean, there's certain minerals, certain vitamins that allow the blood to flow very well, that allow your nitric oxide to which allows you to get an erection to stay hard. If you don't have those elements or proper nutrients to supply those elements, you're not going to be able to get an erection, or if you get one, you're not going to be able to stay there. In addition, diet seems to be, as I said, the French fry and hamburger diet. A high saturated fat, high sugar, overeating kind of diet lends itself to impotence. And then you add on to it the lack of exercise. This is the standard American man nowadays. That is why we're seeing so much problems with it, and probably why I'm seeing so many customers coming in and complaining, in addition to these other factors as well. Now you take these other factors and you stack on it the loads of medications, including hypertensive blood pressure medications, sedatives, tranquilizers, things to calm you down, antidepressants, amphetamines, diuretics to lower blood pressures or get rid of water, and acids. You know, the acid reflux drug is one of the favorite drugs given by physicians, and I'll be doggone, it blocks certain minerals and it isn't going to happen for a guy. Antihistamines, because of all the allergies going out there, ain't going to happen. Antidepressants. So these medications, before you go on them, you better seriously look at whether or not you have issues with this first before you start considering these medications, because that will directly affect your ability to perform. Endocrine imbalances, low testosterone. Since we have so much estrogen dominance in our environment with all the pesticides and the chemicals, oftentimes men are now having low testosterone or low free testosterone levels because of all the high estrogens. We're also seeing abnormal thyroid hormones. Today I had a customer come in and her children were all on fluoride supplements. And I know that's a big thing to give to strengthen teeth. They did that with my son Ian, and he ended up with fluorosis. There's a little spotting on the teeth. His teeth snapped at a moment's notice. The problem is, however, is it also slows the thyroid down. It's an old medication that they used to give to slow thyroid down. So that can affect long-term the development of the thyroid gland, as well as being able to use certain hormones in the thyroid gland in the long-term male performance. So please, once again, strongly think about, before you start putting your children on those fluoride supplements, if whether or not the long-term ramifications might be worth it. Alcohol. Boy, I know we oftentimes think we're going to have a nice dinner and we're going to drink a few beers. Alcohol is not the best way to get good circulation down in the male member or to maintain an erection. And when you combine that with other recreational drugs such as ecstasy, marijuana, cocaine, all the drugs out there that are used, particularly I'm seeing an awful lot by our younger people, in the long run it's going to affect male performance and is going to cause impotence. Cigarette smoking. Now, we know that for every cigarette you smoke, it destroys 25 to 50 milligrams of vitamin C. Okay, and vitamin C is what's necessary to maintain one of the major things to maintain vascular flexibility. Well, you add nicotine on top of that, and if you're a cigarette smoker, long haul, it ain't going to happen. Or you're going to reach the point of impotence earlier on in life. So considering the usage of drugs, medications, your diet, and lack of exercise, if you combine all these together, oh boy, it's no wonder I'm having so many guys come in the door. When we're looking at also then, because of the nutritional deficiencies in the diet and lack of exercise, then we end up with all these diseases, including diabetes. Low blood pressure can also affect as well. Peripheral vascular disease, that means poor circulation because of vitamin C deficiencies, nutrient deficiencies. Swollen prostate, which if you have a prostate swollen, it can cause, well, it's an inflammatory issue and it can cause issues with male performance. Arterial sclerosis, which is a buildup of plaque in the vascular system, which narrows the arteries and doesn't allow for blood flow. When you narrow the blood flow, I'll be doggone, you're not going to be able to get there or stay there as a man. Heavy metal poisoning. Now, I had a customer come in today that I believe has heavy metal poisoning. He was a cable man, and he's starting to have memory issues and circulatory issues, and I'll be doggone, heavy metal poisoning. So if you're in those types of fields where you work around any type of metals, having a hair analysis done in order to determine whether or not you have any heavy metal poisoning is an absolute must. Stress, anxiety, depression, allergies, all those kinds of things that we see physiologically in life can contribute. Now see, that goes hand in hand with the psychological aspect, because what happens is when guys, and you guys know it best, and I also say this for the women so that they have an understanding there of guys, when they have stress and anxiety, girls, I'll tell you, and something doesn't work, then all of a sudden they have this fear and anxiety within themselves that the next time you're together with them, they're not going to be able to properly perform. And then that lends itself and lends itself and lends itself. So the psychological aspect for men is a huge component in whether or not a male can become impotent. I knew I was going to say that eventually. That's a southern way of saying it. Impotent. It oftentimes, like we say, is a self-fulfilling a prophecy for men. So obviously having an understanding partner when something like this is going on is a must. Otherwise, long-term wise, we could see some interesting psychological issues that could affect further performance. When we're talking about diet, and normally you only see me have just a few lines written about diet in this particular issue. On this one, I've got quite a bit written because I believe if we don't address these issues as far as diet is concerned, long-term wise or short-term wise, you're going to have a problem performing. High fiber foods, including raw vegetables, leafy greens, apples, oats, whole grains, they're keeping the sugars stable, it's getting rid of the toxins, it's getting the excessive estrogens that you may collect from all the pesticides you're eating out of the body. Whenever you can do it, please eat organic. And I see more people go, yeah. But you don't understand, see. The estrogens that are found, or the estrogen mimickers that are found in these chemical pesticides can be up to 6 million times stronger than the natural estrogens produced by your body. So they'll block your testosterone from converting into free testosterone, and then good luck. I think every man that's age 50 and above should have his testosterone, free testosterone, estrogens, and DHEA levels tested. Those are all necessary for male performance, but not only that, for your bones, for your overall well-being, those all need to be tested. There are certain foods that are known, and they have some research behind them, libido enhancers, and some of which were somewhat of a surprise. Watercress leaves, sesame seeds, and bee pollen. Oftentimes you use bee pollen for allergies. It can be very helpful, and it's a superfood. Eat pumpkin seeds, sunflower seeds, because those types of nuts or seeds help stimulate testosterone, or the stabilization of testosterone, and reduction of inflammation in the prostate. They're very rich in zinc. Try to eliminate most of your saturated fats, your trans fats, inflammatory fats, and junk food from your diet. So stopping at the local burger place is not going to aid and assist you going home to your wife, getting in bed, and having sex, because it is going to be a problem if you sit there and do that on a continual basis, because you're going to end up with a vascular system that's going to be sludgy. How are you going to have good blood flow if you're going to have sludgy blood? So you're needing to consider eating better foods, much more productive. Don't eat a large meal before sex. So if you're going to go out and sit there and hog away on food and then expect to come home and be able to, on your anniversary dinner, and expect to come home and have sex, it's going to be very difficult, because all your blood is right here. So when your blood is here, there ain't much left for any other places. So try not to eat a large meal before sex. That can affect an ability to be able to get hard and stay hard. There's a lot of supplements out there that have some documentation, studies, and proof, and all the ones I've written down on here all have studies, and they're all time tested. They've been around for some time. I know with my customer base, I've seen these for the last 14 years, off and on, some of which are a little bit newer and more utilized now. A good multiple vitamin high in B vitamins, along with a couple thousand milligrams of vitamin C with bioflavonoids per day, maintains vascular flexibility. You can't vasodilate and have male member be able to get larger if you don't have adequate amounts of good vascular strength and integrity. So keeping a good multiple high in Bs, and I'm not talking about from your local warehouse, along with this extra vitamin C, is necessary to maintain that vascular flexibility necessary in order to get larger. Vitamin E increases circulation. It helps circulation, oxygenation. It slightly thins the blood, so actually it also can help with blood pressure as well too. And I have some physicians that actually recommend it instead of aspirin to slightly thin the blood and keep things flowing as well too. Zinc and magnesium. Now magnesium, the National Institute of Health says 92% of American men are magnesium deficient. Magnesium is necessary for vasorelaxation. So if your vascular system is always going to say stiffen and harden, then you're not going to be able to get that way, because you're not going to get blood going in to the male member in order to get an erection. Magnesium is probably one of the top 4 things, besides a good multiple vitamin C. Magnesium is very necessary in most people's, for supplementation, in most people's vitamin regimen. We have a local physician that's recommending this one, and there are some really good clinicals that came out about a year ago regarding arginine and citrulline, and I wrote down his protocol regarding this. And I've had some of my senior men come in, one of which said he hadn't had sex for 3 years, came in and said, wow, things are back to normal again for me and my wife. So pretty awesome. And it's definitely worth a try. These are taken on an empty stomach at the various times that I have listed on here. Ginseng. And now it needs to be the right type, which is Panax ginseng with the proper amounts of ginsenolides. They help with both drive and with the ability to get an erection. Ginkgo biloba. There was a study done with a couple of thousand men in which they utilized ginkgo biloba, and they did right about 120 milligrams twice a day. Now you have to watch ginkgo if you're on blood thinners. You can't do high amounts or any of it if you're thinning the blood already with things like Coumadin or warfarin types of products. Ginkgo, 75% of the men surveyed said they had an improvement in their blood flow and ability to maintain an erection, and that's a pretty substantial figure. When you consider that was such a large pool of men that they did the sample testing on. DHEA, there was a 6-month long study of between 25 and 50 milligrams is what was found appropriate based upon body weight. And the majority of the men also saw an improvement in libido and male performance. Cordyceps. Cordyceps we use a lot for breathing, for people who have asthma or for energy or endurance. 800 milligrams twice a day of a particular CS4 strain helped with libido and impotence. There are several herbs, and I've written Murapama down, and 500 milligrams 3 times a day. Oftentimes you can get these male formulas that will have some Yohimbe, Murapama, it'll have Damiana, some of the herbs that have been studied to help with male sexual performance. They can be helpful as well too. Now, I didn't want to leave homeopathy out because there are certain homeopathic medicines that you can take that can aid and abet some of the emotional aspects and physical aspects of impotence. So, you can go hopefully find a good book on homeopathy, or actually better yet, have a doctor of homeopathy give you an analysis and get a proper formula for you of what maybe might be able to help you as well too. Homeopathy is a little bit more complicated in that you have to know the emotional aspects of an individual to determine the proper medicines and dosages as well too. Anyway, that's kind of it in a nutshell. I hope that helps. The next time we talk, we're going to be talking about the women's portion, and that's the difficulty in a woman being able to reach an orgasm, and or some of the drive involved with even wanting to even have sex. So I hope this helps. We're going to be moving on next to our fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show. And since we're entering the swimsuit season, I'm getting questions on what you can do to tone things up. And I have a lot of ladies who are noticing a little bit of droopies in their bust lines, who've asked me to help, or asked me at the store what exercises they could do, some of which do not want to go to the gym. And so I pulled out some old isometric exercises that I thought may be able to help tone and help support the breast line as well as the muscles surrounding it, so that we can get a little bit of a lift. And oftentimes too, after certain surgeries, particularly breast reconstructive surgeries, obviously you cannot do weights, and these are some exercises that were shown to me by a trainer that can be utilized to help tone some of the muscles during recovery and get certain circulation into the particular area. Now, in the old days, they used to have us go like this, we switch around like this. In today's times, we work it from all different angles. We're going to hit with what we would call the lower portion of the muscle tissue, the middle portion of the upper tissue, and then the upper portion of the what are called pectoral muscles. So what we're trying to do is we're trying to work the whole support system along with the little supports in here as well. If you do these isometric types of exercises, holding them for about 30 seconds at a time, and you work your way up gradually as best you can, not only are you going to get some toning in the particular pectoral muscles, but you may see some suspension support in the shoulder girdle as well as your arms. I hope that exercise is helpful. Next, we'll be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano.
Thank you for that intro. First off, we're going to start off with a little bit of pharmaceutical trivia. The question is what class of diabetic drug lowers your blood sugar or blood glucose levels by first making you fatter? Yes, making you sweet like a sugar plum. So your mom wasn't completely wrong. But think about that till we get to the end of the segment. Now, radiation protection. Obviously, it's always been a concern recently because it's been a lot of the news. And the Japanese did find out that resveratrol, usually something from grapes or from wine, did protect against radiation exposure. But, and this appears in the ACS medicinal chemistry letters, what they discovered is not all resveratrol protects against radiation. They found that resveratrol protected cells in flasks, but did not protect it actually in mice or living organism. However, acetylated resveratrol did protect the animals in mice from radiation damage. Acetylated resveratrol is also inexpensive. So when looking for your choice of resveratrol, especially for radiation protection, try to make sure it's acetylated. And that's the one you want to look for. All right, after that, H. pylori, back in the news. Don't get rid of it yet. Basically, what they found out that the DNA from H. pylori, common stomach bacteria, minimized the effect of colitis in mice. And that was just one. This came out of a report from the University of Michigan Medical School. What they discovered is that basically the majority of infected individuals with H. pylori may never develop any ulcers or cancers. I think it came out that 15% develop ulcers, 1% may develop cancers. But the benefit far outweighed that. The research basically showed them the further evidence that we should leave these bugs alone. This is in no words. There may be a benefit to hosting them in the stomach. Meaning don't kill them with antibiotics the first time it's detected, like many of the people out there are doing. They said H. pylori has coexisted with the human race for more than 50,000 years, as far as we know. And although it was linked with peptic ulcer disease and stomach cancer, only a minority of affected patients will ever develop these complications. They said the H. pylori infection is more commonly found in developing countries or those with poor sanitation. Why? Because it's virtually very little incidence of colitis, salmonella, or other inflammatory bowel diseases. The study, researchers found that H. pylori is uniquely immunosuppressive in a good way, that high numbers of sequences have known to also inhibit inflammation. They found that mice receiving H. pylori DNA lost less weight when they had colitis, less bleeding, and greater stool consistency. Now guess after how many doses of H. pylori? Just one. They said with one dose, there was a significant difference in the bleeding and inflammation in the colon. In previous research, the University of Michigan gastroenterologists also found that H. pylori reduced the severity of inflammation of the colon by salmonella. Remember, salmonella used to be a plague. We did this before. H. pylori basically helped us evolve past that salmonella poisoning. It is amazing that the bacterial DNA not only directs the biological behavior of bacteria, but also has significant influence in the gut immunity of the host. The information may have important implications down the line with us in regards to disease manifestation. So something to think about. There is a strong benefit to H. pylori. Don't wipe it all out. Get it in balance. That's the main thing. After that, we go to another demonized thing which is highly necessary in our diet, LDL cholesterol. And this is in a titled article called Bad Cholesterol, Not as Bad as People Thinks. Shows Texas A&M University News Information Services especially. Also published in the Journal of Gerontology. Their work with the University of Pittsburgh, Kent State University, Johns Hopkins Weight Management Center, and Northern Ontario School of Medicine. So this isn't just one researcher, one research lab. The studies showed, especially when it came to exercise, that after fairly vigorous workouts, participants who had gained the most muscle mass also had the highest levels of LDL bad cholesterol. It showed that you need LDL to gain more muscle. Could explain why a lot of people on cholesterol-lowering medications, cholesterol-lowering medication, are in pain all the time, especially muscle pain, because the LDL is required to build more muscle, especially you people out there working out. Now, with my experience with athletes, they've always had consistently high LDL levels, and yet they never could figure out because their diets are so freaking clean. They also said that LDL serves a very, these are their quotes, not mine, LDL serves a very useful purpose. It acts as a warning sign that something is wrong, and it signals the body. The LDL signals the body to these warning signs. It is doing the job it is supposed to do. It is like finding water next to a fire. Look for the fire engines and the firemen. Then find the fire and put it out. Don't shut the water valve off because all you see is things all wet. People often say, I want to get rid of all my bad LDL. But the fact is, if you do, you would die. We need to change the idea that LDL is always being evil. We all need it. We need it to do the job. And the more LDL you have in the blood, the better you are able to build muscle during resistance training. And this study could also be helpful looking at sarcopenia, where people get muscle wasting as they get older. They may not want to be lowering that LDL or giving cholesterol medications that can mimic the effect of sarcopenia. Oh, that would be a good one. All right. After that, let's look at bone building. Well, the first articles are coming out knocking the bisphosphonates, the biophosphonates that are out there. University of Illinois, also published in a recent issue of Nutrients, found out the best thing to do is to take calcium and vitamin D, not the bisphosphonates. They said, and they knocked them really heavy, they said the scientists that prescription bone building medications are expensive and have many side effects, including, ironically, an increase in hip fractures and jaw necrosis. They should only be used if diets and supplements don't do the trick. So get away from your lazy doctors that just want to prescribe you these drugs. Bisphosphonates, for instance, disrupt normal bone remodeling by shutting down the osteoclasts, the cells that break down old bone and make new bone. When that happens, the bone is built on top of old bone. Yes, your bone density is higher, but the bone is not structurally sound. A bone density test does not measure the quality of the bone itself. That's something to think about, and they looked at 219 studies over 10 years. Calcium and vitamin D beat them all in true efficacy. All right, now I'm kind of running out of time, so I wanted to basically show you what diabetes drug makes you fatter. It's a class of drugs called TZDs, or thiazolidinediones. What they are is your Avendia and your Avendia metamorphin combinations. But what they do is they're quite protective, they said, and they make you fatter. So the excess nutrients can be stored in your fat tissues. They said that's why these TZDs are so effective at lower glucose. The extra fat cells become the storage containers for nutrients that would otherwise be harmful if stored in the other side of the other parts of the body. So in effect, making you much, much fatter to store all that good sugar. Well, my time is up, and thank you for the time.
Thank you very much. We appreciate you joining us. Do your research upon the subject matter we've talked about and whatever else will suit you. Thank you very much. Very interesting, huh?